Hello, I'm Dr. Cheryl Lee from Singapore. I'm an ophthalmologist. This clinic was started about 10 years ago. In Singapore, we're getting 3 out of 10 children at the age of 7 who need glasses because of myopia. I've seen my child since he was 4 years old and he's checked every 6 months. And the moment should he be diagnosed with myopia, he will be started on treatment. So what options could we have? And these are the questions I need to answer to myself as well. Whether he would be on, say, an eye drop and then wearing myopia control glasses. Would he have any other options? Yes, he could have the option of a contact lens that he wears every day when he goes to school, or a night contact lens, and he wears it at night and he takes it off in the morning, and no glasses or contact lenses throughout the day. I think these options are something that we can discuss with the child. Myopia control is an absolute no-brainer because the benefits of treating outweighs every risk that you can think of. And what is worrying for me, and I feel very sad when I find children who are diagnosed late, is that myopia is irreversible. So when they attain a certain level, there is no way we can reduce it. So let's get on with making sure that every child understands about myopia control. Right, Kylene, I'm Dr. Cheryl Lee. I'm your eye doctor. When did you start wearing glasses?
When I was 9 years old.
You're 9 years old. How old are you now?
10.
You're 10 years old. So Daddy, when was this picked up?
Well, picked up in school when she was about 9.
So we've checked your prescription today and it's -2. So -2 is like the medical way of saying it, but it's what we call 200 degrees. So it has increased in a span of 1 year, because she's 10 years old now. That is the expected increase. If we go by research, the degree increases by 100 per year. So here we have an eyeball. We've got the lens of an eye and we've got the film of the eye. So what is happening with your eye? If this is the front and this is the back of your eye is just growing longer and longer and longer. So this is not good. We need to stop it from growing any longer. I can't reduce it. So it's rather like your height. I can't make you shorter when you've reached a certain height. So what we really need to do, or the only thing we can really do now, is to make sure it doesn't get any longer. So I have 2 jobs that I have to do. One is to help you see clearer, and the other one is to stop it from getting longer. On your part, you also have 2 things you have to do for me. One is you have to spend at least 1 hour outdoors every day in the sunshine. The second thing is if you put your hand out, anything between your finger and your eye, that's considered near. So if you read, if you draw, if you're on your iPad, your phone, 20 minutes, after which you have to take a break for 20 minutes. It's not a brain break, it's an eye break. So you don't go from doing homework to going on the iPad. Would you like to continue with glasses and then an eye drop every night? Or would you consider, say, wearing contact lenses?
What are is there like any proof or any kind of certification these treatments have?
Yeah, so Misight, it's by a company I think you might have heard of. It's called Cooper Vision, so it's rather well established. And it's the only lens that's FDA approved. So if you're very much into American research, then that is important. The research is good, but it does involve hard work on both our parts, right? So that means you wearing the contact lenses for 8 to 10 hours every day. And again, it's also keeping to good habits. So nothing is magic. It's not as if you wear contact lenses or glasses and we have special eye drops, then we can do whatever we like go on the iPad for hours or draw for hours, okay? So that's a no-go anyways.
Being a contact lens wearer myself, that is definitely something I'm much more comfortable with.
Okay.
Yeah.
And Kylene, is that something you would like, that you wouldn't have to wear glasses when you go to school?
Yes.
Yes. Do you do any sports?
Yeah, she does martial arts.
Okay, so then that's a big benefit. So that might be the motivator, right?
When can we start?
So if you're ready, then what we'll do is we'll have you see our contact lens practitioner, and she herself wears a contact lens. So she's very good at teaching adults as well as children.
Hi Kailin, so today we're going to learn how to put on and remove your contact lenses, okay? So before you touch the lenses, make sure you wash with soap and rinse it thoroughly with water, okay? Make sure you dry them well, so none of the fibers from the paper towel will be on your fingers, okay? Okay, so now, before we start, I'm going to put on for you first. And then after that, I will teach you how to put on by yourself. Alright, we remove your glasses. Okay. Are you a right-hander or left-hander?
Right-handed.
Good. So what we're going to do, we're going to put on your right index finger, okay? You make sure that the lens side edges are curled up like a bow, right? Okay. Then what you do is, we're using your left hand middle finger, you hold the upper lid, and the right middle finger, pull down the lower lid and put it at the center of your eye. Look around to center the lenses, and then let go and blink. Is it good?
Yeah.
So shall we do it by ourselves now? Okay, so now we'll wash your hands. Okay, so we're gonna put it on your index finger. So we make sure that the lens are cut up like a bow. So you go close to the mirror, you hold the upper lid with your left middle finger, yes. And then you hold the right lower lid with your right middle finger and look straight. Okay, and you put in the lens at the center of the eye. Okay, very good. Good. And then you try to look down for me. Okay, look straight again. Let's try again, okay? Now, hold the lower lid with the right middle finger and then go close. Okay, touch your whole eye. Very good. Okay, and slowly let go. Look around. Up, down, left, right, and let go of your both fingers and blink. Is it okay? Yeah. Yes, good job. Now, shall we learn how to remove the lenses?
Yeah.
Okay, so what we do when removing the lenses, right? You hold the upper lid with the left finger again, and then the right lower, because you are right-handed, right? So left hand, upper lid, middle finger, right hand, middle finger on the lower lid. You look straight, and you gently pinch the lens up. Okay? Sounds easy?
Yeah.
Okay, we hold the upper lid, yes, with the middle finger, and the right middle finger you hold the lower lid, and you gently pinch the lens up. Yes, good job. Yes, high five. Now Kailin is ready to start her contact lens journey. Just a few things to take note. So basically, always make sure she wash her hands thoroughly before she put on the lenses. Make sure that she doesn't swim or sleep with the contact lenses. Make sure she doesn't overwear the lenses. Do not wear the lenses if they are damaged or if they are expired. Okay, and always attend the review appointments. Alright, any other questions so far?
Yes. What if she overwears the lenses? What could happen?
So if she overwear the lenses, say she sleep with it or she wear for more than it should be, let's say 2 days, 3 days, because this is a daily lens, there could be a risk of infection.
Oh, okay.
Any other questions?
No, I'm all good.
Are you ready to start your contact lens journey?
Yes.
Yes? Okay, good job!